Okay, here in this patient we are searching for leukoplakias, and we see white leukoplakias in ultrasound. Here also in cystoscopy I can differentiate these tissues. In the trigone she has white leukoplakia. The second portion of the bladder I look after trigone is nowadays look at these infected particles. This is coming from left kidney. Sometimes kidney is also affected from these infections. This is also epithelial shedding, and it may be because of dehydration, waiting too much for the procedure in the hospital may also cause this, but sometimes this is because of infection. Look at the leukoplakia here. These are really too much. And the second part is the back wall. I can differentiate whitish tissues here, some reddish part here and here, not too much, but they are significantly different. Look at the bowel movements. I can see it easily, the movements of the intestine. It's normal. Now I'm emptying the bladder. I wonder if this red part will come into contact with the trigone when the bladder is emptied. Look here, the trigone, the leukoplakia. Okay, now I am refilling. This part is the diseased part, and it's in contact with here. Actually, not in contact with this part. So we will mark our leukoplakia lesions now, and keep an eye on the bladder. Okay, this is inflamed here. I will make a little fulguration there. I hope the rest of the bladder will be healthy. Just not to forget, I am putting a mark here. Here. The rest seems quite healthy. I wish it does not bleed. Okay, now the better urine is coming out from the kidney. And here I will come until here in the left side. This is right orifice here. And here there is a border. But behind it, yeah, a little inflammation. Maybe I will make some spots here. Look at this part. Okay. And the upper part of the urethra. Okay, difficult decision. Is it inflamed or not? We make a comment it's healthy. Okay, so I will mark the border sample right now. Okay, look at this different tissue. I'm making a superficial fulguration and control the base if it is normal. It's not easy to make a decision about the thickness. Sometimes, if I think it is not enough, I can increase the energy of fulguration, but I don't want to go deep inside too much. quite enough. So these differentiated unhealthy tissues are going now. They are disappearing and new tissue will come and it will be healthy. Quite superficial in this lady. He has the disease from his childhood ages, but I think she didn't have too much and too bad flares. At least she says baking soda was enough for her for a long time to cure her from the flares. And it was a superficial leukoplakia. What I see here, but it didn't disappear with lots of medications, so she chose to have this operation to get rid of all the medications completely. Maybe I have to stage the diseases, and I can call this stage 1 disease. The problem is just in the trigone. I can call it stage 1. If the problem is here from the trigone past to opposite walls, we can call it stage 2. And if it is disseminated to side walls, which is not happening in this case, they are not bleeding here, we can call it stage 3. And if all the bladder is very badly inflamed and bleeding from everywhere, we can call it stage 4, maybe it may be irreversible. So this case was a real stage 1. And I hope she will have a nice recovery. We have to make a comment and conclude that this weakness is enough. We are an experienced team here. My nurse is also joining the operation with me in every case, and he is commenting on me this is enough or not. Okay, one more time to the upper part. Here, I noticed the small whitish area and to make a little fulguration here. Unfortunately, our instruments are not designed to see this upper part of the bladder. It's very difficult to make comment on this part. So in each case, we are very carefully exploring this part, but still it's not easy to be sure and confident that we have not missed anything. So sometimes to be on the safe side, I fulgurate this part even if I see nothing, such as in this case. Okay. I'm looking for reddish parts. The bladder didn't bleed, it's good. Sometimes when I empty the bladder, it begins bleeding. This is our last control. I am emptying the bladder, taking out, vacuum cleaning these particles. Look at these particles. I want to leave the bladder all clean from the infected particles. So, just like a vacuum cleaner, I am vacuuming the urine inside the bladder. All of them come out. Okay, now we emptied the bladder. There is not too much bleeding, just little spots here. This is, I can say this is nothing. I have a little small fulguration here. No mucosa out there. Not too much bleeding. The side walls are the most prone parts. Yeah, it's healthy bladder. I don't have any concerns. Okay, this is the vaginal part. Cervix is one of the healthiest cervix we have ever seen. It is completely normal. Yeah, it's okay. Pardon.
Hocam bir dakika dursun.
Okay, now we are looking for cervix uteri. It seems quite healthy. One of the most healthiest cervixes we have ever seen. It's good, no problem. And the vaginal walls are normal. There is not too much discharge. Nice.